I've been talking to John and the colleagues around, the sector, and I suppose there's a focus at the moment that we're at a change point, or a point, an inflection point, where there's challenges, but there's also opportunities in that. And I thought it would be useful, just at the outset, we in the HSE have just published a corporate plan. So it sets out an approach for health over the next 3 years. And it sets out an ambition, really. You wouldn't have the capacity on your own to implement all that's in it. But I thought it would be useful to see, just to talk briefly, not to go into the whole document, and I have copies of it here, but to just look at that and the big themes and the big goals that are in that, and maybe to look then how that could apply to yourselves, and how will that be discharged or implemented at a local level, and how would you engage with that in terms of the disability sector and the organisations that you have, and then maybe to look specifically at the disability sector in that context. So I'll try and do this in about 20 minutes, and that we would have a question and answer session after that. So the corporate plan sets out it's our approach as an organisation as to what our ambition is over the coming period, and I think that comes as well at an important time in the political cycle as we move into an election in the new year, and a government that would be facing into the next 5 years most likely. So I think that's important. And so it sets out as a corporate strategy, I suppose, about trying to develop the best or a world-class health service. But I think you'll be particularly interested in that idea of providing services to people where they need it and when they need it. That idea, I think, from a perspective of people with disability, is important. And of course, like all corporate plans, there's a vision and mission and values. And just in terms of the mission there, I think an important part of that is that people in Ireland will be supported by the health and social care services to achieve their full potential. And I think that's really relevant to people with a disability as well as society as a whole. And I think that's an important one. And then I think the issue of values. And if we don't have values as a cornerstone driving where we want to go as a society or as a health service, I think we wouldn't be starting from the right place. And so we have there the idea, I think, that people would buy into, of care, compassion, trust and learning. And we try to build that into what we would do. And I think it's important. And it's just, we've talked here before, when I presented it to you before, I talked about the values within the underpinning, if you like, the social care division and the system and so on. And so the corporate plan would try to translate that then into specific high-level goals. And the plan that's there sets them out in great detail then, and I don't intend to go into that. But I think just to say that, the first goal there, the idea of promoting health and well-being, I think is really important in that it positions health in a context which is much wider than just illness, the removal of illness, or it takes, account of the whole determinants of health. And it recognises the Healthy Ireland policy that has been published and so on, which is really important to people with a disability in a very significant way, in that it addresses part of what John was referencing there earlier, is that so health and social care will provide a certain level of support, but it's really across society and government as a whole and other government departments that the full requirements and supports to people with a disability need to be joined up and provided at a local level if they're actually to experience life in a way that's fully realises their potential. So that's a challenge for us then as a society, as us at the health service, and for other government departments to do that well. I think also the third goal there, obviously the second one, access, is a hugely important piece. I think everyone would recognise that. Goal 5 is all around the resource management and accountability and so on. But fostering a culture, I think, that's honest, compassionate, transparent and accountable. That whole issue of culture, I think, is fundamental as well, and the cultural change that's needed. So I think that's something we wanted to focus on. And so for the next number of years, we're in a process of changing how we deliver services in Ireland in terms of health services fundamentally, and reorganising our system so that we can do that better. And you'll see the second point there is about creating empowered and accountable health service delivery system through community health organisations at a local level, and we're developing 9 of those, and the hospital system and so on. But for you, I think that issue of the community health organisations at local level will be fundamental. And I think, you know, how you engage with those as organisations and how we support you and those communities to enable and support their own people, I think is fundamental. So I just wanted then to take a minute to talk about that then, that, you know, what are these community healthcare organisations that are going to be important for you as organisations and for people with a disability in terms of engaging with them. And so just to set that out. And I think the bylines I've had there is integrated care, so joined up care, joined up service. It's a thing that people say, it's hugely important, doesn't always happen, and it's a fundamental thing. And that other point about supporting communities and looking at disability services as mainstreaming services locally. I think that's important, and we're trying to put in place a structure and a service model that will enable that, working with colleagues in other government departments. So, not sure how familiar people are with that, John, or not, but 9 community healthcare organisations is what's being developed. That's the map of Ireland as it reflects on those. And if you get into it, what's more important and fundamental in this, I think, is this idea of 90 primary care networks across the country. So that's populations on average of 50,000, ranging from 35 to 70. And we really want to develop a system where they become the fulcrum around which we support people. And so fundamental to that, there'll be about 10 networks in the community healthcare organisation. So a place the size of Cork and Kerry would have maybe 12 or 13 of those. On average, it would be 10, about 50,000 population. And 50,000 is a population that you can actually know and serve. And so the idea is to have, from a service point of view, one person in that network of 50,000. Primary care teams will be working there with one person who has responsibility to pull all that together, to link in with specialist services, would link in with general practice, link in with the acute hospital system, and that we would have one lead GP who's working in that as well. And the idea is about building strong community relationships, also standardising how we do things and making it simpler for people. Key worker and team leader, key things, I think, for people with a disability in terms of service provision become an important look at that. So here's what it would look in a particular area. So in the Midwest, Limerick, Clare, South North Tipperary, that's a map of how these networks would be. So in that location, there'll be about 8 networks. And we picked this as an illustration. If you see up in the top left there, the light green, that's, East and West Clare. It's a natural population of 35,000 people. Right beside it in the darker green, you have Ennis and Shannon. Now you could administratively just say, we'll split those and make them 250s. And so it's nice, and it's everybody will have 50,000. But in truth, how people live and work and move would mean you'd leave the network of 35,000, that's a natural gathering, and GPs and others, and how people transport and so on, and you'd leave Ennis and Shannon there as a 70,000. And so you'd take account of local circumstances, and these then would become the focus and where people engage and link in with the services. So I think that's important. And I think if we just put structures in place, it will be for nothing. So it's about changing how we work together. So over the next period of time, it's going to be important that we standardise our pathways of care, as we call it. So how do we engage? How do people gain access to services? How do they gain access to hospitals and so on? That we try to make that simpler and simpler for people. And as well as that, about this idea of integrated care and joining up services across hospital and community and across the community services themselves. The whole idea is to deliver the right service at the right time in the right place by the right team. And that's really important because people with a disability require different needs at different times. And we have a strong emphasis in our system in social care in keeping the rest of the service clear that people with a disability aren't patients. They're patients some of the time, like the rest of us when they go into hospital, but most of the time they're looking for certain support so that they can live life independently, and that's what we want to do. So they need to gain access to different types of teams at different times, and part of what we're about is joining that up. That's just the governance structure. It'll reflect, primary care, social care, mental health, health and well-being, and I won't dwell on that too much. What does it mean for people? That whole issue of streamlining and making it simpler to gain access to services. And I suppose this idea of local decision making, devolving down to local level where decisions are made by people who know the people that they're serving and try to build a system that does that smartly and quickly. And that's what we're about. So that's what's going to be before us in terms of developing and enabling local communities and supporting them to support their own people. And that type of structure is being rolled out over the next number of years, and you have the kind of corporate strategy that I was just setting out there. So what then, in that context, is the challenge for disability services? So we are going through a process. Many of you, I've talked to you before here about the Value for Money and Policy Review, which is a very difficult name for a transformation programme for the disability sector. But I suppose a key challenge is to move from segregation to inclusion. That's a really important thing, and about mainstreaming services in a way that hasn't happened before. We have to take account of the ageing of the population in Ireland generally and try to plan for demography. We don't get demographic funding generally for services, and we've come through 6 or 7 years of really difficult budget reductions as opposed to increases. Gladly this year things are starting to improve, and for the first year we have had an increase. So I think we have to look and plan for the future around that. Equally, we have to take account of the increased prevalence of disability. The complexity of needs is changing. If you look at the various databases that we use, you can see the challenges coming down the tracks. So a point I've been making for some time is that we do need additional resource, and we must make the case for that. But we also have €1.4 billion currently tied up in our services, and there's a real question about, are we using that to best advantage, and how do we need to re-engineer and reorganise that so that it responds better and in a more effective way for the people who use those services. So that's a strong issue, and I think that if we want to secure political support and if we want to secure resource, we're going to have to do those two things at the one time. We have to demonstrate the need, evidentially based, for more money to do new things and to support additional people, but we also have to demonstrate that we're using the existing resource in a better way. So that's a real challenge, and it's something that we have to face up to. I've just set out the policy approach there, and I've mentioned the VFM policy review. It's something we're working with the department to try and see, can we call it something else that people would relate to in a better way? Because when you mention value for money, people think straight away that you're talking about cutting budgets and so on, where really what we're talking about is a transformation programme for the sector. And I think that's something we might need to look at. I'm not going to spend long at this. It sets out a whole range of aims. The one point I would say about this is that, you know, we need to look at the totality of what has to be done. So down on the bottom right, we need to move to a person-centred support model in the community. But there are a whole range of building blocks we have to put in place, resource allocation models and so on, and things like that. And we have to build that and do that sensibly. And I think for us collectively, we need to be able to communicate this in a way to the public and to those who use our services in a way we haven't been able to date, because I don't think people follow what we're trying to do, and therefore they can't buy into it. This is just the governance structure. John will be familiar with this. He's sitting on the steering group for this implementation framework. So I don't intend to go through it, other than there's a comprehensive process there in working groups and so on at national level trying to roll out a change programme. I do want to touch on governance and accountability, because it has been a big feature. Since I talked to you last, there's been a lot of engagement in the Public Accounts Committee and elsewhere, and comment about governance and so on within the sector. And so, you know, a lot has been done to strengthen that over recent times. We have been working with organisations like DFI and the voluntary sector providers in the Federation and so on, and we have now a much stronger service arrangement. We also have a strong governance and accountability process, and we are moving to a stage where we will be very significantly trying to link the funding we're providing to the activity and outputs, the cost, quality and outcomes, and that focus on outcomes for people at the end, because that's going to be an important thing. It brings you into setting targets and measurements and so on. But instead of that being some kind of an academic thing or something that we talk about as between administrators. This really has to be about what does it mean for the service user in the local area, what they can get, what are they receiving, do they know that they're receiving the service, do they know how much it's costing, have they a say in it, have they, if you're in a residential centre, have you a proper contract, do you understand what you're receiving and what's supposed to be provided for you, have you a say in how your daily living is organised and so on. So all of that type of thing is what we're talking about. We've also developed a separate head of compliance, Brian Purcell, who is heading that up now, and that's to support us all in engaging with the new charity regulator and then also to provide oversight for us as a board. So I just wanted to touch on this then, this idea of the challenge of change, because we've been through a whole range of changes over recent years. And I suppose part of the thing is that if we together as a sector are going to try to move forward together, what are the challenges and what is it that makes it so difficult to implement significant change? And I think two of the, up at the top there is the journey. So it is a journey and it's something that we have to do together. So we have to collaborate and we have to try to work together on that. Challenge for me and the team that I work with is to try to do that in a way that's open and engaging, challenging of course, but that it's collaborative and that there's a dialogue between ourselves and the sector so that at the end of the day, what we're doing and how we're organising ourselves meets the needs of the people that we're serving, and it is about serving people. So that issue then of management and leadership. So management, in one way, I think of it as coping with complexity. It's a management task. But leadership is about coping with change. And so we together must provide the leadership for our sector to move from where it is to where it needs to go. And we need to work together and have a process between us that enables that to happen. I think the next bullet there or point is this idea of building a coalition of support. And in all the change that I've been involved in, I think this is one of the most fundamental parts of it. Because if you want to move from where we are to a future somewhere else, we need to bring people with us. So we need to build that coalition of support among those people we serve, the public and local communities that we're engaged with, the political system that speaks for the public and has a determination of the resources that are allocated. So there is a piece about building that and a shared dialogue and then action taking place, agreeing what we're to do and then holding ourselves to account as to whether we're doing it or not. And in all of that, the issue of learning. Because if we don't leave ourselves open to recognise that we make mistakes, we don't always get it right, we need to be able to be flexible enough to change as we go. And I think that idea of change must be supported, and the idea of the steering group and all that goes with that John's involved with, that's part of the process of supporting ourselves in doing this. And then at the end of the day, up at the top left, this issue of culture. Because we really do have a fundamental issue, I think, and about this issue of culture and how we perceive the disability sector, how we perceive people with disability and so on, and how collectively we must work to change that, whether it is ourselves with our staff or whether it's in local communities and the public generally. So I think that's part of the challenge that rests before us. And having said all of that then, what's the next steps? Where do we go from here? So I think that idea of the governance and so on, one of the things we're doing is using the service arrangement. So the funding, we provide $1.5 billion funding to the sector. So we want to use the service arrangements that govern that to actually drive out the change programme. So to do that and to become clearer and to have a greater accountability and clarity about how we're doing that, we have to recognise, as I said, that we have to provide more resource for additional complexity, for additional service need, for demography and so on. But we also have to ensure that we're using the existing resource to best advantage, and that means it has to change from where it is now. Another important piece is the culture. I've mentioned that, and this idea of seeing disability as the mainstream, and that's one of the reasons I put up this whole thing about the community healthcare organisations, because I think that's going to be a really important building block, that engagement. So health will be working through these community healthcare organisations at a local level. But we need to engage with yourselves, we need to engage with local authorities, with the Department of Education, with social welfare. And so I see yourselves and the type of network of supports that you have as a great link between all of those. And I think the health service has to work in a far different way with organisations like yourselves, both in terms of communication, but also in terms of how we work together and how we engage and achieve that broader, joined up, integrated approach. And I think there's a real potential around that. For that to be successful, you'll have to reorganise how you operate, and we will as well. And we need to do that collaboratively. There's a specific piece about scaling. So the idea, we've done a lot of work on piloting and developing models. Some of that around income support, some of around a lot of it around demonstration projects around residential centres and so on. And I think we have to move to a stage where that scales now, and that the pace of implementation has to increase. Because clearly we can see, if you look at the residential base people with disabilities are living in, whether it is intellectual disability or physical and sensory disability services, they're in a traditional older type of model that needs to move into something new. And we've seen what's learning from Orders of Tracta and from other type of residential centres and the challenges that are there about meeting standards, and where the level of practice is far below what it should be. So we need to change, and we need to change at a pace that's faster than where we are today. To do that, we will require what I call transition funding. So there's a lot of resource tied up in existing services. So I use an example of a place in Cork I used to have responsibility for. It's known as Grove House. There was 28 people with severe and profound challenging behaviour and so on living in that centre, and it wasn't fit for purpose. But there's €3 million of resource tied up in it. And so by providing some seed funding, so we as an organisation at the time used €1 million that we were able to generate as seed funding to begin a process of moving those people out. And by doing that, you could start the process. The €3 million is freed up. I get back my €1 million and we start again somewhere else. So that takes a period of time. It takes a lot of planning. There has to be consultation and engagement with the service users, their families, local communities. A lot of planning and work has to go into it, but it can be done. And it can be done in a way that meets people's needs. So it wasn't just a case of closing Grove House and moving to another centre. Many of those individuals went into individually tailored services that suited their needs, and some of them went to smaller residential community homes. And so that process is not yet complete. It's still in process. But it gives a very good illustration of how we can start to release and unleash the kind of resource that's existing and support people with a disability in a different way that meets their needs in a far better way. I think that's important. Capital funding, really important part of that. When the Congregated Settings report was written and so on, it was clearly recognised that not just for decongregation, but for community living and independent living, capital resource will be required, or resource to lease properties and so on. And I think that's something that we haven't been able to, because of the downturn in the economy, we haven't been able to secure that resource at a national level. A lot of work has been done on it. Political system is working with us, and ministers and so on. And I think that's something that we will see progress on. And I think it's important because with all the work that has been done in planning, we're kind of at a stage where we need the capital to move it on and to make a big shift from where we are to where we need to go. I think in addition to that, this idea of a reform fund, again, of using funding to transition from where you are, we've developed that. You might have seen it announced in the last 24, 48 hours that a reform fund has been developed through the department, ourselves in the HSE, Genio and Atlantic Philanthropies. A reform fund is now in place, and we will use that both in disabilities and mental health services to start to support this transformation. I think the other important piece to mention is the issue of assessment of need. We have work underway with the NDA of trying to develop a national standardised tool that will support the system and support people. The idea of commissioning and resource allocation, that idea I talked about linking funding that we're providing to the activity and outputs, cost, quality and outcomes, and the focus on outcomes being something we have to seriously develop because we're only at the beginning stage of that. So a lot of work has to be done there. And then the last 2 points, I think, just to reprise, I suppose, something I said earlier, this idea of building and maintaining a coalition of support. And if we're to be successful, collectively, we have to do that in a way that has been different to what we've done before. And we need to work. It will be challenging because we'll have to challenge each other. We will have to push each other to do things in a different way. And that is demanding, and it can be difficult. But I think also it can be very rewarding. And where we can look to evidence where we've done that before, we have done it very well. And therefore I think that there is evidence to show that in some parts of what we do as a system that we can do this successfully. And that last piece then is a communication strategy. And I know that John and yourselves are focused on that. I think we as a service are also very much focused on that in trying to get out a message that while the perception might be there currently because of what we see with the implementation of HICWA standards and the challenges there, the impression might be there that not a lot of good is happening within the sector. Whereas actually those of us who are working in it know that there's very significant and positive things happening, while also recognising that the type of situation we saw in Ours Attract and in others is simply unacceptable. Absolutely. That should drive us on to do more and do it faster and better. But I think there has to be an acknowledgement of a significant positive range of things that are also going on in the sector. I was just talking outside around the Deaf Village and with colleagues that I hadn't met in a while. And when you look at something like that, I mean, you know, very few people actually are aware of that and the benefits it brings. There are many other examples. The Next Steps program that the Federation are involved in, over 750 people with no additional resource have moved out of congregated settings into out of inappropriate day type of services which were traditional in nature into more appropriate, person-centred, tailored to themselves. We don't get that message out there. And I think that's important. I think the other part of it, as well as telling people about what we're doing well, it is about building a support and an acceptance within Ireland and within our sector and elsewhere that we need to join up our approach, not just within health, but within local government, within other government departments, and that it's only that collaborative working at a local level that will really succeed in providing the kind of supports to people with disability that they need. And therefore I just finished then on that idea of the 90 primary care networks, 50,000 population, focused around the people that we serve locally. I think that offers a lot of opportunity for the future and offers a lot of opportunity for people with disability to participate locally as ordinary citizens, the same as the rest of us. Thank you very much.